Hi there, welcome to the September All Hands Update. It's my pleasure to be with you and share this time together. It really is such a ongoing honor to know that you're out there providing services to people who need it. And it means the world to me that we get to have this co-creation together of building a business that intends to do well and give back to our patients and families. So I just wanted to take a moment and just really acknowledge and thank you for being on this journey with me and being devoted to remarkable care the way that I am. So I want to remind you, as I always do, of our strategic goals. So we are here to build a company that is first dedicated to remarkable care, and second, it's sort of specifically, we're interested in an area of care that is sometimes untouched or unappreciated, and that is continuous complex care of high-tech patients, both adults and children, living at home or wanting to live at home, and as well as children in general, right? So we want to make sure that there is services available for families and patients in the state of Connecticut, and the funding source, adequate funding source that enables access for these services. So that's really our top primary goal, is to be an advocate as well as a provider for complex care, children and adults, providing at-home services, enabling them to live at home and not in an institution unless, of course, they want to. So that's our first goal. Our second goal that we are constantly looking at is our desire to be a great employer to you. And we want to be able to feel good about who we are as an employer and how we relate to you, the employee. And so we want to be recognized as the preferred employer of home health nurses in the state of Connecticut. That is our 10-year goal, our 2028 goal. We want to do that now, and we want to do it into the future. These are our company milestones. You've seen these all before. We started in 2016, and we've made our way all the way to here. We're in September now of 2019, and we've been able to accomplish a great deal in that time. So one of our big goals, one of the ways we measure success, is through the number of hours that we provide, and therefore demonstrating our strategic imperative to serve these audiences that would otherwise not be served. And so we're serving 8,200 hours a month right now. You'll see that number probably, hopefully, dramatically increase in the September and October timeframes. We're bringing on lots of new patients right now. The fulfillment team, Christine and Patty Ann and Taylor and Christina, are really dedicated and focused on that end right now. And Amy and her team of people training, Jennifer, is doing a lot of training, and we are really appreciative for all the work they're doing to cultivate and bring people on board. And then to all of you who are the direct care providers who go out there and provide those shifts wholeheartedly. So here are our 2019 objectives. So we want to grow continuous care according to the monthly service forecast, since we want to get to 13,000 hours. As I said before, we're at 8,200. We want to see those numbers continue to increase. We were at 5,500 in March, and if we look back here, I think in February we have data, we were at 2,500. So we've gone from 2,500 in February of last year to 8,200. So we are growing quite nicely, and we should feel good about it. We just want to make sure that we continue to wholeheartedly expand and get to our 13,000 by December. The second is to expand services in our skilled medical practice. So this is the area where we provide visits to children and adults. We're one of the few agencies in Connecticut that provide skilled medical visits. And with the addition of our new case manager, Kelly Noel, who came on board last month, in the month of August, she has brought with her tremendous expertise as well as patience from her previous agency that closed, and she came on board with us, and we are honored to provide services to her wonderful group of patients. So that's increased our numbers quite significantly, and we are honored to have that. We have another couple of nurses in similar situations coming on board in the September, October, November time frame. So we should see these numbers grow. So I'm giving them yellow green. I do think we'll definitely hit our 200 visits per month. We might even hit it in September. However, I want to make sure that we continue to be also focused on this 1/3 Medicare. I don't think we'll probably make that goal this year, and I'm okay with that. It's okay to set goals that you don't always meet, but to keep them in mind for what you're trying to go for. Right now, Medicare accounts for about 10% of our skilled medical practice. We'd like it to be 33. We probably won't hit 33 by the end of this year, but we hope that we're laying the foundation by developing relationships with doctors as well as with hospitals who over time will share patients with us that also have Medicare and not just Medicaid and private insurance. Then we wanted to focus on here the number 3, hire, onboard, and train 10 to 15 clinicians per month. We haven't hit our 10 in a while. I guess we did in May. So June we hit 5 and 6 in July. I haven't officially heard the word of the numbers in August yet, so I'm assuming it's going to be probably in about that same number, 5 or 6. We expect September, however, to be significantly more than that. We should definitely hit our 10. I hope that we will hit closer to 20. We're having a hiring extravaganza in September, and September 10th we're at Bridgeport, and on September 12th we're in West Hartford, so circling the wagons for nurses who live in those areas. We've also been focused on hiring case managers and RNs. We've reached out to over 6,000 RNs through a campaign, and we have several new people that we've brought on board. So Holly has been on board with us for a short time. She officially passed her boards early in September, and she is officially a case manager now and continuing to do great work in the field. Kelly came to us bringing lots of patients from her previous practice. Robin also joined us, who will be and is a case manager in training, along with Judith and Stacy. So Judith started on September 9th, and Stacy will start with us on the 23rd. So we have lots of new case managers coming in. You may have a change in who your case manager is or supervisor is, and please take the time to really welcome them and let them know how grateful we are to have them on the team. Then we have our average hours per week. So we want to be at about 25. We've been hovering at 20. We'll see how we can shake that up over the next couple of months now that we're through summer. 95% of visit notes complete on time. This has been a huge focus for 2019. It's a very important piece of it's one of our wildly important goals, connected to our wildly important goals of being able to fill, bill, and collect on time, according to the monthly service forecast. And so this piece helps us really tremendously. If you could see the work that Jennifer and the Jennifer Coleman does, our finance manager, along with Christina Coelho, in trying to sort through notes that are late, it really is a challenge. So getting your notes on time is extremely important for a whole variety of reasons, including helping out our team members, but also for compliance reasons. So we have a monthly drawing, and you'll find out who the monthly winner is, the September winner of $250 in a later video. No more than one call out per employee per quarter. We're still doing okay here. We had a couple of hiccups in the summer. We're hoping that now we are in the month of September, we see people more in their regular routines and fewer call-outs. And lastly, 80% fully scheduled for continuous care patients. So we're at about 74%. You can see we've, kind of what our numbers have been. We'd like to be at 80, +%. All right. So I wanted to mention again, our company WIGs, fill, bill, collect, continuous care monthly hours according to the forecast, as well as August through December conduct a monthly mock survey. I'm excited to tell you that we conducted our first mock survey in the month of August, and Marie, our absolutely tireless administrator, has been compiling those results, and I look forward to sharing those with you soon. So again, here is what our WIGs look like. We fill, bill, collect is up here in the yellow is what our company goals are, and down here you'll see what the team wildly important goals are. And direct care operations right here is this WIG of improving timeliness of documents. So very important. What else is happening? So I want to give you a big heads up, and there'll be a separate video on this, but we're going to not do a video training in October. We're going to have in-office training. So please watch that video and get yourself prepared for it. We're having a hiring extravaganza in September. So everybody who gets hired in the month of September will get a $500 signing bonus. Typically we do that on a sliding scale. This month we need to hire people for our open cases and the cases that are coming on board. And so we're really trying to encourage people. We also are offering an employee referral bonus right now. So be sure to refer your all the people that you know that could be a good nurse and care provider for our patients, and you will benefit from receiving a bonus, employee referral bonus from that as well. We are continuing to do orientation, interviewing, and recruiting in Hartford. We're continuing to push through the correction plan from the March DPH survey. I think annual competencies now are pretty much all done, thank the Lord. We're implementing the 4 disciplines of execution. Part of that is, of course, the on-time notes. That's the part that direct care staff is most focused on. We're also going to be rolling out the Access Continuous Care electronic note starting in October. And we're preparing for our survey, our Medicare accreditation survey, and that could happen at any time. So, and the other thing that I didn't put here, but I think I mentioned in last month's or the months before, is that we're now officially doing what's called the CAPS surveys. And so that's part of Medicare accreditation. Once you have more than 50 patients, and we have over 100 now, we are then required to do a process where an outside company calls our patients and surveys them for how well we're doing. We did a video last month or the month before, I can't remember, and gave you some information about that. So that's rolling out now too. Lots of good stuff happening, and be sure to watch the October in-service training so that you're prepared for it. Really fun things happening at that meeting, and have a great month and go make the world a better place. Thanks.